How to manage myelosuppression from cervical cancer chemo. How can you manage myelosuppression from chemotherapy for cervical cancer? Myelosuppression is a common side effect of chemotherapy that leads to decreased blood cell production in the bone marrow. This can increase the risk of infections, anemia, and bleeding. Managing myelosuppression effectively requires a comprehensive approach that includes monitoring, supportive care, and sometimes adjustments to treatment. First, regular blood tests are crucial. These tests help monitor the levels of white blood cells, red blood cells, and platelets during chemotherapy. Early detection of any decline in these counts allows for timely intervention, which can prevent severe complications. Supportive care measures are also important. For instance, granulocyte colony stimulating factors, known as GCSF, can be given to stimulate the production of white blood cells. This helps reduce the risk of neutropenia, a condition characterized by low white blood cell counts. If anemia occurs, erythropoiesis-stimulating agents may be used, but their use must be carefully managed due to potential risks. In some cases, transfusions may be necessary. If blood cell counts drop critically, red blood cell or platelet transfusions can help manage symptoms and prevent bleeding. It is also essential to educate patients about the risk of infections and the importance of maintaining good hygiene. Prompt treatment of any infections is critical. If myelosuppression becomes severe, oncologists may consider adjusting the chemotherapy dose. This could involve reducing the intensity of the treatment or delaying cycles to allow the bone marrow to recover. This approach balances the need for effective cancer control with the need to minimize side effects. Emerging therapies are also being explored. Research is looking into agents like bispecific antibodies, such as cadonilimab, which may provide effective cancer control with potentially less myelosuppression. Additionally, some studies are investigating compounds like ginsenoside RG3 for their potential to alleviate chemotherapy-induced myelosuppression. However, these should be considered adjuncts to standard care, not replacements. Finally, a multidisciplinary care approach is essential. This often involves collaboration among oncologists, hematologists, and supportive care teams to tailor interventions based on individual patient responses and risks. In summary, managing myelosuppression from cervical cancer chemotherapy involves vigilant monitoring, supportive treatments like growth factors and transfusions, possible adjustments to chemotherapy, and consideration of novel therapies under clinical guidance. Always consult with healthcare professionals to optimize treatment while minimizing side effects.